All right, good afternoon, Southbridge. Welcome back to the EOC brief. I'm with Jasmine, who's going to be our linguist for today. We've got Chief Woodson, who will be briefing the Emergency Operations Center's information. We also have Harry and Jess from Harrington Hospital, who will be giving some more details than we normally do because of the rise in COVID cases within our community and within the state itself. So I'm going to start off, I'm going to open this up, and then I'm going to finish my portion, and we're going to bring Harry over here, and we have Jess to my right, so you'll be able to ask questions, they'll provide some information to you guys, so let me pass this to Jasmine before I forget.
Buenos días a todos en Southbridge, estamos aquí hoy, bienvenidos al reporte de la operación de emergencia del pueblo de Southbridge. Estamos aquí hoy con el concejal Adams, el jefe de la policía, el Chief Woodson, y también están con nosotros Harry y Jess del hospital de Harrington, que nos van a dar más información y van a contestar preguntas porque estamos en una etapa de riesgo alto.
Chief, no. No. Right back over here. Just leave it on us, I'll reset. Thank you. Thank you, Chief. All right, just wanted to let you know the town status right now. We're in a red category. That's based on numbers from DPH, COVID-19 report. This means currently we're a high-risk community. Though we are a high-risk community, we will stay in phase 3, step 2 of the staged approach. Now, if we stay in the red category for the next couple of weeks, we will have to revert back to phase 3, staged 1 approach. But if you need more information, there's public data, or actually town data, on the mass.gov website.
Entonces, para un informe del pueblo, estamos presentemente en la categoría roja del Departamento de Salud Pública. Eso quiere decir que somos una comunidad que estamos en riesgo alto. Entonces, si continuamos en este riesgo alto, presentemente estamos en la etapa 3, nivel 2 del nivel del Estado. Si nos permanecemos en este nivel por 3 semanas en corrida, entonces tenemos que regresar a la etapa 3, nivel 1. Para más información sobre estas etapas, puede ir al mas.gov del gobierno del estado de Massachusetts.
Today we had 13 new cases within our community, and again I just want to reiterate, those are 13 Southbridge residents. So any numbers that we do provide, those are residents of Southbridge. Total so far since the pandemic, since we started keeping track of the numbers, we have had 438 new cases reported. We've had 299 cases that have been closed or recovered. We have, unfortunately, again, 10 deaths within our community. We've had 122 active cases that are still in our town. We also have 7 cases that the state is reporting as ours after further investigation based on our health inspector. Those 7 cases do not belong to Southbridge.
Entonces, sobre los cuentos y los números desde el día de hoy, tenemos 13 new casos reportados. En total tenemos 438 casos de residentes en el pueblo de Southbridge, 299 casos que han sido cerrados o recuperados. Entonces, desafortunadamente, tenemos 10 residentes que han fallecido y tenemos 122 casos activos en nuestro pueblo. Tenemos 7 casos que habían sido reportados por el pueblo de Southbridge, pero la investigación del Departamento de Salud averiguamos que eso no era de los pueblos de Southbridge.
Last couple of things, school meals, just wanted to reiterate this. The school district is continuing to provide meals typically on Wednesday from 3 to 5 p.m. at the Charlton Street School. The bag for pickup has 7 breakfasts and 7 lunches in it. Also, because of the holiday, the schedule has changed, and the week of November 23rd, they'll be distributed on Tuesday. Actually, that was yesterday, due to the holiday schedule, so everybody should have already been informed on that one.
Entonces, sobre las comidas de la escuela, el distrito de la escuela va a continuar a dar comida típicamente los miércoles de 3 a 5 p.m. en la escuela de Charlton Street. La bolsa para recoger tiene 7 desayunos y 7 almuerzos adentro de la bolsa. También cuando hay tiempo de vacaciones, esas comidas la dan un día diferente. Entonces ayer hubiera recogido las comidas para esta semana.
And public information page, we've been talking about this for quite some time to reinstate our public information page that we stopped the first week of July of this calendar year. We have started that public information page back up. By close of business today at the town hall hours, the public information page should be on the red banner. So if you go to the Southbridge website, town hall's website, you should notice that on there. It's both in English and in Spanish, and we will attempt to update this every Friday. There are some cases where we can't get it to you by Friday, but by Monday, that following day, it should be fine and posted up there again. That will be with numbers. One thing I did not add to this was sometimes our numbers do not match what the state is reporting. So what we have in the town is the most accurate of our Southbridge residents and our numbers.
Entonces, para la información pública, la página de información pública que desde julio hemos hablado que íbamos a poner la información de nuevo en esa página. Esta lo puede encontrar en la página del pueblo de Southbridge. Entonces la parte de arriba tiene una parte roja. Van a intentar a dar más información cada viernes, y a veces los números en esa página son diferentes que los números del estado, pero van a intentar a tener los números más recientes en ese informe, en inglés y en español.
And lastly, before I turn it over to the chief, I just ask that everybody remain safe during this holiday season, and I wish everybody a happy Thanksgiving tomorrow. Thank you.
Y antes de darle al jefe el micrófono, entonces quiero que se permanezcan seguros y saludables en este día de vacaciones y de feliz día de acción de gracia.
Okay, I'm going to go ahead and turn it over to Chief Woodson.
Hi, good afternoon. Just as far as the Emergency Operations Center update, our last Facebook Live event was on October 28th. And our last EOC meeting was this past Monday, November 23rd. Unfortunately, due to the recent uptick in COVID-19 cases, we just wanted to host another event prior to the Thanksgiving holiday.
Entonces, bienvenido. Para informarle, el último evento live de Facebook fue el día 28 de octubre y nuestra última reunión de la operación del Centro de Operación de Emergencia fue el 23, el lunes del 23 de noviembre. Y porque ha crecido los casos de COVID-19 en nuestra comunidad, queríamos tener otro evento en vivo en Facebook hoy para antes del día de la ascensión de acción de gracia.
Councilor Adams had mentioned this already, but I want to mention it again. Today we're very, very fortunate to have Harry Lemieux, who's our CIO at Harrington Hospital, and Jess Casaldisi, who's the Chief Nursing Officer. They're kind today to volunteer their time to come and attend our event, so I just want to thank them for that.
Hoy quiero darle las gracias. Yo sé que el concejal Adams mencionó esto, pero tenemos la fortuna de tener a Harry y a Jess de Harrington Hospital con nosotros hoy para darle más información.
And again, they'll be happy to answer any questions, so anything regarding COVID. So please feel free to message us. We have our Fire Chief Paul Momenden and our Town Council Chairman Jack Jobin, who are here. They've been here every day with us since March, and they'll respond quickly to this possible staff.
Entonces ellos tienen ningún problema en contestar cualquier pregunta que ustedes tengan. Tenemos el presidente del concejal, Jack Jovian, aquí, y también el jefe de los bomberos, el jefe Norman, aquí con nosotros. Entonces tenga confianza en hacer cualquier pregunta que usted tenga.
Just a couple of things regarding some of the governor's orders that have been released in November. Regarding Order 55, which was released on November 6th, or put into effect on November 6th, you must be wearing a mask at all times. All of our police officers have masks on at all times, whenever we're in public. That includes any traffic details. So if you see a police officer in public, they will have a mask on. And the reason why I mention this is it also applies to you. If you're in public or on a public way anytime, you must be wearing a mask.
Entonces, unas cosas para mencionar sobre las órdenes del gobernador. Por la orden 55, que fue en efecto el día 6 de noviembre, que todo el personal necesita usar máscara a todo tiempo cuando estén en público y cuando estén haciendo detalles de tráfico. Esto le aplica a todos ustedes y también a todos los policías cuando ustedes los vean haciendo detalles en la calle, en la comunidad. Ellos van a tener máscara, pero usted también necesita tener su máscara.
Per Order 54, as far as gathering limits, and I'm sure you've all heard this before, but I just want to stress it again. Try not to have more than 10 people over your house for Thanksgiving, and if you're outside, no more than 25.
Y por la orden 54 sobre los límites de tener personas en su casa para el día de feliz acción de gracia, usted necesita tener no más de 10 personas adentro de su casa y no más de 25 personas si están afuera.
And the police department has seemed to have gotten a lot of questions about the stay-at-home advisory that was put out on November 6th. It's an advisory from 10 p to 6 a. It is certainly not a curfew. And again, we've got a bunch of questions about that. And our primary role here at the police department is just to educate you and to achieve voluntary compliance. So it's not a curfew, it's just an advisory.
Entonces, sobre una clarificación sobre el aviso del Estado de quedarse en su casa entre las horas de 10 p.m. a 6 a.m. que el gobernador usó hace unas cuantas semanas. Este aviso no es mandatorio, pero es un aviso solamente. Nuestro deber es para educar a las personas y que usted voluntariamente pueda hacer esto voluntariamente.
And just a few things to mention regarding some upcoming holiday events through our current public health crisis. The fire department will be doing a Santa parade tomorrow. That's Saturday, November 28th. It starts at around 3 p.m. All the routes where they'll be traveling with Santa will be posted on their social media page, also on the police department media page.
Entonces, sobre la parada, que va a ser mañana, empieza a las 3 de la tarde y es el sábado 28 a las 6 van a celebrar las Navidades.
And there's another event that we were debating whether or not to have. It's going to be a parade rolling rally tomorrow to kick off the Christmas season. That starts at 6 o'clock. The parade and the tree lighting, or the rolling rally and the tree lighting, will look a little bit different this year, but we've spoken with the Board of Health, and we believe we can host this event safely.
Entonces, creemos que podemos hacer estas actividades en una manera segura y saludable, y va a ser el 28 a las 6 p.m. para celebrar las Navidades.
And like I mentioned during our last Facebook Live event for trick-or-treating, it's your call as parents. If you don't feel safe, you have any pre-existing conditions, you do not have to participate in the rolling rally tomorrow.
Entonces, como mencionamos anteriormente en otras etapas, que es voluntariamente. Si usted no se siente seguro, pues no tiene que asistir a la parada o los otros eventos.
And we transitioned this year from a parade more to a rolling rally, and that's to try to keep people from gathering within close proximity to each other.
Entonces el evento va a ser de esta manera, en vez de tener un evento donde las personas van a estar juntas, para estar más seguros lo tenemos en una parada para que siga, las personas no estén juntándose en paradas juntas.
And rather than go over all the routes here on this event, I just urge you to go to our Facebook page, go to the Holiday Visions Facebook page, and all the routes will be mapped out for you.
Entonces, no vamos a revisar todas las rutas aquí en este evento hoy, pero puede ir a la página de los policías en Facebook y obtener la información donde dice Holiday Visions.
It's the Southbridge Holiday Visions Facebook page or the police department page, just to make sure.
En la página del Departamento de Policía o Southbridge Holiday Visions, la página que dice ese título.
The Christmas tree will be lit this year, but I know many of you have come out in the past. There'll be no gathering on the town common.
Entonces vamos a prender los árboles de Navidad, pero no van a haber un evento para que las personas vengan, solamente van a prender las luces de los árboles.
And if you haven't done so yet, if you want to have a float in this event, you must call them or go to their Facebook page and register. Don't just show up because you will not be allowed to participate.
Entonces, si usted quiere participar en este evento, hay que llamar a las personas que están poniendo el evento junto, pero si usted solamente llega ahí, no va a poder participar con un vehículo.
And lastly, our next Emergency Operations Center meeting is scheduled for Monday, December 7th at 10 a.m. Happy Thanksgiving to all and stay safe this holiday season.
Y lo último, que nuestra próxima reunión del Centro de Operación de Emergencia será el lunes, el día 7 de diciembre a las 10 a.m. Y que tengan un día feliz y seguro de acción de gracia.
Hi, good afternoon, everyone. Thank you to the town and Chief Woodson for having us. My name is Jess Calcedesi. I'm the Chief Nursing Officer at Harrington Hospital, and I appreciate the opportunity to speak with you a little bit today regarding COVID and COVID-19. I don't think it'll be a surprise to anyone to hear that our latest results are that there are 12.5 million cases across the country. We've had 250,000 plus deaths. And unfortunately, we are seeing a second surge in COVID. I think it's safe to say that we're nowhere near the number of hospitalizations we were in the spring. In the spring, we had, on average, 3,500 hospitalizations across the state. As of today, we are at 909 hospitalized patients. That being said, I want to let people know that a month ago, we were at 361 people.
Translation.
Oh. Okay.
December,
She needs to kind of catch up as you.
yeah, just to go a couple sentences and then we'll have Jasmine try to repeat as much as she
Yeah.
can without having
A
to.
lot of numbers.
Sorry. There were 12.5 million COVID cases across the country.
Entonces, buenas tardes. Esta es la jefa de las NORSA del hospital de Harrington y ella está revisando los resultados de los casos. Presentemente, actualmente tenemos 12.5 millones de casos en nuestro país de COVID-19. Han habido 250,000 muertes a través del país y tenemos la segunda sugerencia del COVID-19.
Where I was heading was a month ago, in the end of October, there were 361 patients hospitalized across Massachusetts. Today, there are 909. Those numbers are increasing very quickly.
Entonces, hace un mes atrás, aquí en el estado de Massachusetts habían 361 pacientes, 361.
We were 361 cases at the end of October 1 month ago, and now we're 909.
Al final del mes habían 361 pacientes y ahora estamos a 909. que ha crecido el número.
Massachusetts right now is the 35th highest state for 7-day positivity rates. Wyoming and North Dakota leading the positive cases.
El estado de Massachusetts es el estado en una lista de 35, es 35 de los más altos estados de los casos positivos en 7 días. Los otros estados son Wyoming,
North Dakota.
y North Dakota.
Locally, we're seeing the same. We're seeing our percent of positive rates. We have 2 testing locations. In the spring, we saw a positivity rate of 1.8% to now 3% positivity rate of those patients that we're testing.
Localmente estamos viendo lo mismo. En nuestro hospital, al principio, al final del último mes, teníamos un porciento de 1.8 y ahora estamos viendo el 3% de los casos positivos.
We've seen an increase in patient populations within the hospital. We were running several months following the surge in the spring of no patients to 1 patient. Of late, we've had an average of 4 to 6 hospitalized patients for COVID-19.
En el pasado teníamos un porciento de pacientes con exámenes positivos, resultados positivos de 1.2% a 1.8% y ahora estamos viendo un crecimiento de 3%.
To meet the challenges that we're facing, we're making several policy changes. We have our own internal incident command that we're looking at every policy to evaluate, to ensure we have both safe practices for our patients and for our staff. Of recent, we've changed our visitation policy.
Entonces, para estar con las demandas de estos crecimientos, hemos hecho unos cambios en pólizas. Tenemos un comandante de incidentes para poder responder a estos resultados.
The policy changes with visitation are, we have no visitors allowed. That is to decrease traffic within the organization, as well as protecting those that are coming in for testing and those that are visiting. We want to ensure that everyone in our community is safe. We're also changing our masking policies. In previous months, we would allow any face covering to come into the hospital. It's been since determined by the CDC that gaiters, the scarves that go up over your face, bandanas, face shields that only cover your face and still allow air to be expelled won't be allowed. We'll provide you a mask if you come to the hospital with one of those, that you can apply a surgical mask, and then once you leave, reapply your own mask.
Entonces, otros cambios de póliza en el hospital. Ahora no se permitirá visitantes al hospital para tener menos tráfico en el edificio y también para permanecer la seguridad de los pacientes y del personal. Otro cambio sobre los usos de máscara. Entonces el hospital le dará una máscara apropiada para entrar al edificio. No van a poder usar máscaras como gaiters, I don't have a translation for that, y otras máscaras que usted traiga, se las puede poner después que se vaya, pero ellos le darán una máscara.
We have 2 testing sites, one in Southbridge and one in Webster, that you're able to go on and reserve a test on our website if needed. We encourage folks to look at that. We will be looking at expanding those hours as well as adding some testing time on the weekend.
Ahora tenemos otros sitios de tener exámenes en Webster y en Southbridge. Estamos revisando el horario para extender el horario para los fines de semana y otros tiempos para hacerlo mejor para ustedes.
I would like to let the town know that rapid testing was previously offered with relative ease over the past several months. Of recent, we've recently run into challenges with our distributor, and we're not able to receive the rapid testing kits from the supplier that we had been previously getting them from. That being said, we still have the ability to do send-out testing. The send-out testing does take between 3 to 5 days to result. We are working with another company, another institution, the Broad Institute, that we're just testing now. That's a 24-hour turnaround time. That isn't up and running yet. We hope next week to have that up and running. We'd like to provide testing to anyone who'd like it and with the quickest results as possible, and we continue to work toward that goal.
Entonces, anteriormente teníamos los exámenes rápidos, pero como teníamos problemas con la compañía que tenían esos exámenes, solamente ahora tenemos los exámenes que se mandan afuera y toman de 3 a 5 días para los resultados. Estamos hablando con otra compañía para obtener unos exámenes de 24 horas, pero todavía no los tenemos y queremos tratar de darle estas opciones a ustedes y poder darle exámenes más rápidos.
Lastly, before I turn it over to Harry, I would like to remind people that if you're symptomatic and you're not feeling well, please don't make an appointment if you can avoid it to be tested. Please be seen either by your PCP, an urgent care, or the ER. It's very important that if you're symptomatic, you know what you're dealing with. We've seen with COVID that patients can become ill very quickly. So it's important that you pay attention to your symptoms. If you have questions regarding the data, mass.gov and the COVID dashboard is very helpful and has a tremendous amount of resource on it. And then you can always call the hospital and we'll try to help in any way that we can.
Entonces le avisamos si usted tiene síntomas que no hagan una cita solamente para tener un examen, pero que vayan al hospital o vean su doctor primario o vayan a la emergencia, porque hemos visto con COVID-19 que los pacientes se enferman rápidamente. Si usted quiere más información, puede ir al masca.gov para los informes sobre los síntomas de COVID-19.
Take your time and let her finish.
You got it. Good afternoon, everyone. My name is Harry Lemieux. I'm the Vice President of Operations at Harrington Healthcare System, and we appreciate the opportunity to give some updates on where our system stands with being ready to serve the community in a safe way during this pandemic.
Hola, mi nombre es Harry Lemieux. Yo soy el vicepresidente de operaciones del Hospital de Harrington Hospital y estoy para darles informes cómo podemos servirlos a ustedes mejor a través de esta pandemia de COVID-19.
We've implemented several processes to ensure that we can provide care safely to the community. These include our emergency rooms and segmenting out the waiting areas so that we can properly care for those patients that are symptomatic with COVID and those who may be visiting the emergency room for other ailments.
Entonces hemos implementado varios cambios en nuestro hospital para asegurar la salud de todos los pacientes. Primariamente en las áreas de emergencia hemos separado las áreas para atender los pacientes para atender las personas que tengan COVID-19 y separado de las personas que están ahí para otras cosas.
Within the hospital, for inpatients, we've created discrete inpatient units for those patients who have tested positive with COVID so that we can properly treat those patients in a segmented area, separate from those who are in the hospital for other issues.
Entonces, adentro del hospital hemos implementado una área aparte para poder atender a las personas que sean positivas de COVID-19 en un área confidencial para esas personas.
We also test all inpatients being admitted to the hospital, all patients that are having surgery or surgical procedures or any other high-risk procedures.
También nosotros le damos exámenes de COVID-19 a las personas que entran al hospital para otras operaciones, personas que van a tener cirugía y todas otras tipos de servicios en el hospital, le damos un examen de COVID.
Also, all areas of the hospital, particularly the clinical areas and common spaces, are cleaned regularly using the latest technology and cleaning products designed to protect against COVID.
También todas las partes del hospital donde las personas están o entran o están facilitando servicio están limpiados con un proceso para sacar todos los gérmenes y asegurar que todas las áreas están limpias.
We'd also like to give the community an update on the vaccine and the hospital's preparedness to be able to distribute that vaccine once available.
Entonces tenemos un reporte sobre la vacuna y información sobre eso.
We are working closely with the state and the town to determine when we will receive allocations of the vaccine, and we'll be working with the state and town to determine how that vaccine is dispersed.
Estamos ahora trabajando con el pueblo y con el Estado sobre las informaciones de la vacuna para saber cuándo nos llegará esa vacuna y cuándo podemos distribuirla en el pueblo. Estamos trabajando con esos dos elementos para saber más información.
The vaccine is slated to be available to healthcare workers and first responders in the first phase, following those at high risk in further phases, followed by those at lower risk as more of the vaccine becomes available.
La vacuna estará implementada en diferentes etapas. Primero, para el personal que trabaja en la área de salud y después otras personas que son de riesgo alto y después por ahí hasta las otras personas.
Information is changing daily. We continue to track that in conjunction with the hospital and the Emergency Operations Center of the town, and we'll provide more information when available.
La información cambia diariamente. Estamos trabajando con la operación del centro de emergencia y con el pueblo y para darle información al día a todos y corrientemente.
And I'd just like to echo the chief's sentiment as well as Jess's sentiment that we really need to be careful with large gatherings. We're concerned about what hospitalizations and otherwise will look like after the holiday. So please be safe and thank you.
Entonces quiero repetir lo que dijo el jefe y también que le dijo la jefa de las NOSA, que tengan cuidado con cuántas personas tengan en su casa porque estamos preocupados por el riesgo, el crecimiento de las personas positivas que entren al hospital y que tengamos muchas personas en el hospital. Entonces permanezcan seguros y saludables y tengan cuidado.
Hi again, I just want to thank everybody for watching. I want to thank everybody that came today. Jasmine, our translator, Jess and Harry from Harrington, Mark and Max, behind the scenes that you never see from the cable access channel, our town council chairman, Jack Jovan, our fire chief, Paul Normandin, and last but not least, town council, Dave Adams. Thank you again, everybody, and happy holidays.
Muchas gracias a todos que participaron hoy, a los personas del cable, que nadie los ve detrás de las cámaras, el jefe de los bomberos, el señor Normandin, el presidente del concejal Jack Jovan, el concejal Dave Adams, Jesse Harry del hospital de Harrington. Muchas gracias a todos, muchas gracias al jefe Woodson y que tengan un buen feliz día de acción de gracia. Que estén seguros. Muchas gracias.